I have a question to Dr. Landers. So how often do you recommend the microbiology test? Like, do you have a protocol that you recommend to do?
Good question. Is this on? Yeah. Okay. In case no one heard the question, is how often do you do the testing? I would recommend that you do it on every recall patient and certainly every new patient so that, pardon me, you get a baseline for them. You want to, if they're positive, of course, go ahead and treat. And about 2 to 3 weeks into the treatment regimen, test them again. And that's to ascertain the success of the home care, whether they're doing it and how well it's working. So rather than wait another 3 or 6 months to their next visit, bring them back in for a quick micro check, and that'll tell you the tale whether they're successfully controlling the flora or not.
Dr. Jaffe, the D-penicillamine, you touched on that pretty well, but what exactly is it? And, when does it come in?
D-penicillamine is an amino acid. It goes everywhere that amino acids do, but it's not metabolized. If you are interested in the biochemistry, it's mercaptovaline or dimethylcysteine. Mercaptovaline or dimethylcysteine are different names for D-penicillamine.
Say those again, please.
Yes, I can, and I'm happy to. So D-penicillamine is mercaptovaline, so it's valine with a sulfur, mercaptovaline, and it's also dimethylcysteine. The sulfur amino acid cysteine gets more water soluble when you put more methyl groups on it. Now, the advantage of D-pen is that it goes everywhere across the blood-brain barrier. It picks up any divalent cation. It is agnostic. It picks up any divalent cation, so you can get nutritional as well as toxic minerals on a single 24-hour urine. And we have in our protocol the reference ranges for healthy people on provocation. This is D-penicillamine provocation because labs do not report provoked ranges. They report, and they say it on the report, this is the unprovoked range even though you provoked it somehow. The reason I like D-penicillamine is it's oral. It is very well studied. It turns out D-pen is very important in copper overload, called Wilson's syndrome. Wilson was a UK physician, and in the UK, they have a National Health Service, so he took care of 100% of the ceruloplasmin deficient copper excess people, and it's called now Wilson syndrome. He took pregnant women to term on D-penicillamine. He gave it to pregnant women and had them nursing babies on D-penicillamine. The key to D-penicillamine is to give it twice a week, not every day. Never give it every day because it also inhibits the connective tissue crosslinks in collagen and elastin, and that is very bad. In fact, there are studies by a namesake of mine. We're not related, but I know him because of this story. Ray Jaffe, Israeli Jaffe, gave D-penicillamine to lupus erythematosus and other autoimmune problem patients and got good results until their collagen and elastin unzippered. And then they stopped doing that. Okay? So they don't do it anymore. But if you give the D-penicillamine twice a week, like Monday and Thursday, and then let the connective tissue crosslinks form on Tuesday, Wednesday, Friday, and Saturday and Sunday, you can get the benefit of chelation, removing the toxic metals, without unzippering the connective tissue. It so happens, for full disclosure, that I did my PhD thesis on how D-penicillamine inhibits connective tissue crosslinks, so I know a lot about it. It is made by synthesis. All amino acids today are done synthetically. They are not isolated from any protein or from anything. Way back, a guy named Duvigneau, who was a big deal in chemistry, isolated from penicillin, penicillamine, because penicillamine exists in penicillin. We haven't done that since 1970 at the latest, so you don't have to worry about that. But unfortunately, any bad news about a natural product will will persist in the literature, in the pharmacy, and so you have to be aware. And we have a short protocol, which is for patients. That's mercifully short. But we also have a full protocol for any of you who would like it. We're happy to send it to you, either electronically or... I think we've gone green. I think we prefer to send you things electronically and let you print them if you want. But D-penicillamine, in my opinion, is the chelator of choice to know nutritional status as well as toxic mineral status.
To Dr. Gelb, how do you feel about orthognathic, bimaxillary, they break both jaws and move them forward?
I think in certain cases, and I refer to someone like Bill Hang, that if you need 8 to 14 millimeters of advancement, which is sometimes what you need to treat the sleep apnea because it's a life or death type of situation, that if you can't get them as a kid and do basically a Lefort 1, which is orthotropics or some other technique, that sometimes as an adult, that's maybe your best solution. However, if you don't do the transverse expansion before the orthognathics, you're still with a 500 square foot nose, a tiny nose, and a tiny palate. So if you haven't, and the orthognathics typically won't correct that. So if you haven't done the transverse expansion first, the orthognathics may fail.
I have a question for Dr. Callilung.
You got to stand up.
Oh. Can I extract stem cells from PRF? And then you were talking about dosing, proper dosing, injections, but I don't think you really got to it.
So you're asking me is, can you extract stem cells from your PRF? No. So the source is the blood that you've extracted, and you're looking for stem cells. What you're getting is really exosomes from the PRF, and any other cellular trash that's getting spun around. So I call PRF or PRP exosome light, because you're just getting whatever it is. And it's also the quality of the exosomes will be dependent on the quality of the sample. So instead of a baby source, you're getting an adult source, which doesn't have so much of the exosomes. Did I answer your question?
How would I access that?
Access the exosomes? You just buy it, like Amazon, or one of the biologic.
We do have one question that came in from Canada, from Dr. Warwick, who is watching online since he couldn't get into the country yet. He's asking Dr. Gelb specifically. He says, what specifically is